When should you schedule your internal audit or your supplier audit? When should these be scheduled? A lot of people will follow what's taught in a lead auditor course. They'll take a calendar that covers the 12 months on one axis, and then on the other axis, they'll have all the different processes they're supposed to audit. And then they'll just say, okay, we're going to have auditor 1 do this month, this audit, auditor 2, auditor 3, auditor 4, and they'll work their way diagonally down the matrix, and they'll assign all the auditors, and they'll try to have one audit per month. There's absolutely nothing wrong with that strategy, but it's not strategic. It's just systematic and simple. There's nothing wrong with that at all. But if you want to be more strategic in your planning of audits, think about what the purpose of the audit is. If it's a supplier audit, it does you no good to go do the supplier audit before they've made anything for your company. But probably before you get too far into having them produce product for you, after they've made the first 1 or 2 lots or during the production of their first lot, that would be the ideal time for you to be there, because it's the first time they've made your product. They might have some quality questions about, is this good? Is this not good? Would this be considered a nonconformity? Some things that might be more on the cosmetic end of the spectrum and require more subjective judgment. Those are the times when they need you there. Before they ship a very large order to you, you want to make sure that they're doing a good job of their production. So that's an ideal time to visit a supplier. But if you go visit them before they've made any product for you, you're not going to learn a whole lot, because they have no purchase orders for you to review. They haven't reviewed or confirmed any orders you've submitted to them. They may not even have any raw materials yet for you. They may not have validated the manufacturing process or the inspection process that they're going to use for your product. They have no product in inventory. They might not even have a supplier agreement that's signed yet. All these things are missing. These are the things your auditor of your supplier is supposed to be looking for, and they don't exist. So they're just going to look at some other company's material if the supplier will let them. And that's often a problem, because it might be a competitor, and there might be confidential information that would be obvious to you if you looked at their product and their manufacturing process. So if you're going to do a second party audit, make sure at least they're up and running with your product. And you might even strategically say, when are you planning on running this lot that we placed a purchase order for? We'd like to be there and do our audit at that time. Okay, that's some advice on when to do supplier audits. You could also do it as part of corrective action verification. So if they had made some non-conforming product and you requested a supplier corrective action or a SCAR, supplier corrective action request, if you submitted that, they implemented the corrective actions, and they tell you they're finished, you could look at some of the data that they provide as objective evidence for implementation. But you could also go on site and actually verify that the new process is fixing this. Now, when should you do your internal audits, your first party audits? If you're going to do an internal audit, doing them if you do a bunch of small audits of individual processes throughout the year, just because last year you did it in February for the document control process doesn't mean February of this year is the ideal time to do it. The best time to audit a process is after you've implemented a change or an improvement, or you've got a new employee that was trained, because something has changed in the process and you want to verify effectiveness. If there have been no changes in the process, just like when we evaluate when do we need to revalidate this manufacturing process, the time we revalidate it is after we've made a change. If you haven't made a change to your procedure or your personnel or any of your manufacturing operations that you're conducting, there's nothing changed, so you're not going to learn all that much in an audit. So the scope of that audit hasn't changed, but the amount of activity that's new for the auditor to sample isn't there. So those are audits that you're not going to want to spend a lot of time on. And when you do them, as long as you get them done before your next certification, surveillance audit, or whatever it is, you're doing in good. So you have to do it once a year, but leave those for the end if there haven't been any changes. If there's been a change, then strategically do it right after the change. After people have been trained, after the procedure has been approved, that's the time to look at that process again and see if the changes had a negative impact or a positive impact. And you might still have some time to tweak some things. So if it's an internal audit, you want to do it after a change. If there haven't been any changes, it's a low priority and you might want to leave it for the end of your auditing cycle. If it's a supplier audit, wait until after they have scheduled their first production run for you. So you can either audit it during that production run or just after it when there are lots of records to look at. What other considerations might you have for when you might want to conduct an audit? If you have a bunch of CAPAs that you just closed in your quality system, you need somebody to do an effectiveness check. I coach people when you're doing an effectiveness check for CAPAs, try to use metrics, something objective, maybe a validation acceptance criteria. Those are ideal. But sometimes we don't have that and we need to re-audit the process. If you have to re-audit the process, this is the time to conduct the internal audit of that process. It's after you've implemented the CAPA for the effectiveness check. That's the re-audit time. If you have any 483s, if you have any nonconformities from your notified body or certification body, that's an ideal time after you've implemented those, do your internal audit of that process to verify effectiveness of those CAPAs. And have one of your best auditors look at it, because these are findings from an external body, a certification body or a regulator. So you want to be absolutely certain that those corrective actions were solid. So those might be the audits that you say, for this audit, we're not going to have our normal internal auditor do it. We're going to have somebody from the outside that's an expert in this area. You might hire an ex-FDA person to look at 43s, or you might hire a consultant that has mock-FDA inspection, or if it's somebody that's a notified body auditor in the past, they could come on site and they have better knowledge of the CE marking process, or an MBSAP auditor. They might be able to help you more than some of your internal audit team that doesn't have as much of experience as a professional auditor. And then the last strategic consideration when you're trying to think about when should I do my internal audits, I like to think if all else is equal, and I'm going to do one full quality system audit a year instead of individual process audits, what I will do is I'll try to schedule the one full quality system audit for the middle of the year, or in terms of the year, the middle of the certification cycle. Certification audits occur annually, typically every 12 months. So let's say you have your certification body auditor come in every November. Then 6 months prior to that, or 6 months after that, it's always the same time of year, you're talking about May of the year. That would be a good month to do your full quality system audit. Why? Because you're giving yourself 6 months to implement your corrective actions from the previous surveillance audit or certification audit that you had, and you're giving yourself 6 months to complete any CAPAs from your own internal audit before the next surveillance audit. And does it have to be precisely 6 months? No. You could do it a little bit earlier or a little bit later, and you don't have to do one big full quality system audit. You could break it up into smaller pieces, but that would be my another consideration that I would have. And one other types of consideration, if you know that you are going to have an FDA inspection. So the lucky part of being a class 3 device and having PMA products is you have pre-approval inspections. So before you're going to be approved for a PMA, you're going to have FDA inspectors come and inspect your manufacturing process and your clinical data. So that's a time you're going to have an inspection by the FDA. It's planned, it's scheduled. Doing an internal audit before that to look at the same things the FDA would, a mock FDA inspection or a mock pre-approval inspection would be a really good idea. If you know that every 2 years, like clockwork, this FDA inspector comes to your facility and does an inspection of your company, those are routine level 2 inspections. And you can almost predict, oh, they're going to be coming this year. They didn't come last year, so this year they'll come. And those might be good times to think, hey, maybe we should bring in that auditor that we've used before that has mock FDA inspection experience, and they can do a full quality system audit for us instead of us doing it ourselves this year. So be strategic about planning and scheduling all of your audits regarding who's going to do them. Is it going to be your best auditors? Is it going to be a consultant that has specialty in that area? Or is it going to be an ex-FDA person? Or is this something that's a lower priority audit and we can use one of our greener auditors and give them some training and have the more experienced auditors observe them and give them feedback? So what is the purpose of the audit? And has anything changed? And what is the timing relative to other certification and body audits and FDA inspections would be your primary considerations as to when we're going to schedule those audits. I hope that was helpful, and stay tuned for some more videos on auditing. Thank you. Bye-bye.